She can join the meeting. But thank you. So it was Linda and Phil. All those in favor, please state aye. Aye. Okay. We do not have minutes to approve, so we'll jump right into informational items. And the first is the Board of Health. Is Monica here? No?
No, Monica's not, but I'm going to give that as soon as I click a button.
Okay.
All right, there's Betty.
Hello, Betty.
Betsy Duncan. Hello.
Hello, we already have you added to the meeting.
Thank you.
All right, Monica sends her regret that she wasn't able to be here today. A couple of things from the Board of Health. Annual reports and mortality reports that are referenced in the Board of Health minutes can be found on the Health Department's website. The Board of Health did meet on May 20th, and 3 highlights from that meeting. They accepted the 2023 STI, or sexually transmitted infection report, which saw a plateau in chlamydia and a decrease in gonorrhea. However, they're also seeing an increase in syphilis, which is being seen nationally. Board of Health is also kicking off their strategic planning process as a certified health department, and one that's nationally accredited. They have to do that every 3 to 5 years. Their planning process was last done in 2019 with an adoption for the 2020 to 2022 year, but due to the public health response to COVID, they extended that to December of this year. Lastly, from the Board of Health meeting, the Health Department met the standards of the local health protection grant review findings for food safety, potable water, and on-site sewage. In fact, the comments shared were substantially met. Monica and the team are currently working on a variety of state grant applications. Most of their grant funding cycles start July 1. It's roughly 60% of the health department's revenues come in the form of either a state or a federal grant. And that federal grant could be a direct federal grant or a federal grant that is passed through the state. The health department will be releasing the community health survey beginning in June. This is part of a 3-year needs assessment and improvement plan cycle that's done in cooperation with OSF St. Francis, Carl West, Heartland Health, Woodford, and Tazewell counties. They have to do that to get a sample size big enough to analyze the data throughout the entire county, specifically outside the city of Peoria. So as an example, the health department found that obesity was highest in the northeast and northwest regions of Peoria County, so implementing an evidence-based program with OSF targeting that geographic region. As it relates to Health and Human Services, they're fully in cross-training mode to be prepared to begin centralized intake when they move into the new building. That includes training staff, restructuring management, and updating grant applications. And then later this afternoon, the executive committee will be looking at the bids for the community kitchen for the building. And then lastly, there's the 2024 Mission of Mercy, which is June 28th and 29th at the Civic Center, and that's 8 a.m. to 3 p.m. at the Civic Center. It's hosted by the Illinois State Dental Society Foundation. They travel to different parts of the state to support a free program. That program targets individuals that need dental treatment but can't afford it. So it is, for those 2 days, it is free dental care for anyone that shows up. Information about the program and the event has been sent out to the nonprofits that the health department works with, the Continuum of Care, social media, 211, etc. They do need volunteers, and Gretchen will have some further information that we'll push out to everyone. That is Monica's report, and I doubt I could answer any questions, but I would certainly try.
email any questions to Monica. Care and treatment. I think we have nothing here. Their minutes are in the packet. EMA. I said Jason. Good afternoon. Nope. It's not on. Nope, it's not on yet.
Now it is.
Now it is.
All right, thank you for your time this afternoon. So I believe you should have a copy of my report in your minutes. Just some things I wanted to point out, particularly with respect to our significant events. You'll see that we began and we're having routine communication or webinars and calls with the CDC regarding H5N1 that's been found in some dairy cattle herds throughout the United States. And I believe to date there's been at least transmission into 2 humans. So we continue to work with CDC, or at least participate in calls so that we can be as aware as possible with respect to that. Additionally, you'll see that we participated in some planning meetings, both for Soulshine Reverie, which was the large music festival that was just held up at Three Sisters Park over the weekend, as well as we'll continue to do some planning for Red, White, and Boom. That's our July 4th celebration. And I've also put on there, we're in severe weather season, so it's not uncommon that when we get severe weather, we'll have routine calls with the National Weather Service. And one of the cool things they do for us is they provide us significant event support. So there's a number of events that happen in the county where we actually reach out to them and we get significant event support. Soulshine Reverie is a great example. For example, Friday, I don't know how many correspondences I had with OSF St. Francis, who was at Three Sisters Park throughout that event, as well as the promoters and the sheriff's office, just keeping them up to date as those storms were rolling through. Because when you have 10,000 plus people in one location, if we have to evacuate them, we need a little bit of time. It's not like going to your basement at home. So we'll have significant event support for Red, White, and Boom. I just spoke with the Weather Service this afternoon or on my way down here about Parkapalooza that'll be happening in Peoria. So we do this for quite a few events. We'll even do it for some of the small county festivals we see, like in Princeville, Elmwood, and jurisdictions. And it just gives us an opportunity that if we're going to have severe weather during those events, we have a direct contact with the Weather Service on a routine basis. Just our regular meeting attendance. So again, post-COVID, we're playing emergency management now. We're doing a lot of meetings and plannings with community partners and working with them just to ensure that we're as prepared as anything for when the next event happens. A number of trainings we participated in. You'll see there's been some there specific to the H5N1 avian influenza. I'd like to point out and thank Jennifer, and I believe it was Betty, participated in our crisis leadership training we did at the firehouse. It was a great training. The example we used that day was our instructors from TEACS talked about the Mandalay Bay shooting in Las Vegas, and just the various things that a community needs to be prepared to deal with if we have an event like that. I think we had some discussion that day. Even we've got we'll have upwards of, sometimes they say 100,000 people in downtown Peoria for Red, White, and Boom. And so it's good for us to be talking about if we had an unfortunate incident like that, what are we prepared to deal with that and what things are going to be necessary. Exercises, we continue a number of exercises. You'll see on there that we've completed our after action report for a hazmat exercise. That exercise we held at the Hannah City Work Camp. So I want to thank Scott for allowing us to use that site for a number of exercises. We also we worked with the Illinois Air National Guard Civil Support Team. They used that site for a full day exercise. And then I think it was about a week later, they used the EMA bunker site in our location. So just an example of some of the collaboration we do. Some of the upcoming exercises we've got planned. We're working with the Greater Peoria Sanitary District, so we've got a tabletop exercise scheduled with them in the event something happened and we were unable to treat wastewater. How would that affect us as a community? I'm working with Bradley University. We'll be doing some exercising with them. As we've seen, if you watch the news, there's been demonstrations and some incidents and events on many college campuses across the United States. And so, again, we just want to be prepared as a community should something like that happen, or how can we best support them. And I'm working with the elections. We'll be doing a tabletop with the Elections Commission, preparing for the upcoming election in November, where we've invited State's Attorney's Office, County IT, Sheriff's Office, I think Peoria Police Department, and some other parties to, have a discussion about a number of different. We get a lot of information from the State Terrorism Intelligence Center on the potential risks or threats of the elections, and so we just want to make sure, again, as a community, that we've had some discussion regarding some of those things. And the big exercise I'm looking forward to is we're going to host in September. We've identified a lot. You may have heard me talk about in the past. Two things break down in every emergency and disaster. Communications is one of them, and the other that breaks down almost always is command and control. And so we're going to do a specific command and control exercise with leadership throughout the county and the city in September to not worry so much about some of the tactical things we do in many exercises like decontamination or moving equipment or putting fires out, but really task our senior leadership on some important decisions that they may need to make when we have our next event, things maybe evacuation or how resources are utilized, because there will come a time when we won't have enough resources to community respond, and somebody's going to have to make a decision on who gets those resources. So I've got some information in there on grants. Our program is fully grant funded, at the public health side at least, and so we're always reaching out to NACHO for additional grants. We've been able to collaborate with the Continuum of Care on a wound care project to help them, and I'll be working with Kate Green next week to put those together, and then we'll be getting those out in the community. And we've offered a number of different adult and pediatric CPR, AED trainings, first aid for members of the community. So again, the more people we've seen, CPR, if you can initiate CPR when it's just amazing how we can increase the likelihood of that person getting to a hospital and getting the care and treatment that they need. Outreach, one of the cool things there, the Emergency Connection newsletter I got, I think, is pretty cool. But the really cool thing on this would be that you may be familiar in the past, we do an emergency expo out at the shops at Grand Prairie in July. And in the past, it's if you've been there, it's chaotic. There's a lot of kids. There's a lot of noise with respect to fire engines and dogs barking. And this year, what we're going to do is prior to that event, we're going to host a little bit smaller deal for, we're calling it a sensory hour. It's to specifically provide the opportunity for maybe children or adults with autism or things where the actual expo may be overwhelming for them. So we want to give them an opportunity to meet with first responders and working with the police department. One of the things they're going to do is like some mock traffic stops so that an individual that may have autism can see just exactly what might happen if they're pulled over by a law enforcement officer. And the whole goal is to provide them some comfort that just because you're pulled over doesn't mean something bad's about ready to happen, but just expose them to that. So we're really excited to be able to offer that for the first time this year. We continue to work with the police department, the City of Peoria Police, the Sheriff's Office, and the City Fire Department in development of a citizens emergency response team. Volunteers are going to be a key when we have a next large-scale emergency or disaster. We don't have I'm a shop of one. We don't have enough of first responders in the community to answer the call when something happens. So we're really going to lean on volunteers. So development of that CERT team is important for us. I shared that in the past, I was re-elected or re-volunteered as the chairperson for AMT's consortium, for their paramedics consortium. So it's a great opportunity for me to collaborate with one of our local nonprofits and work with them in ensuring that our community has well-trained individuals to provide EMS services for us. And then I mentioned I'm a shop of one. We have an open position. I've worked with Monica, and one of the things that I've addressed a lot or had a lot of discussions with my colleagues about is one of the areas we lack in emergency management is engaging the behavioral health science or sociologists, because a lot of what we're trying to do in emergency management, at least with the public, is to change behaviors, encourage people to make smarter decisions. When the outdoor warning siren goes off, don't go on your front porch, but go to your basement or a shelter. And so we've rewritten that job description to include some, to hopefully entice somebody with some more behavioral health science experience or background. And we'd like to get something like that engaged in our preparedness program. And then I'd just like to conclude with I drafted a letter for my signature and Chairperson Dillon's signature, and you can see it went to the two senators and our congressman with respect to the reduction in funding that we've seen in the Emergency Management Performance Grant. The state of Illinois took a $1.9 million reduction in that grant. We're not sure how that's going to be passed down to us at the local level. Right now, our IEMA staff doesn't believe that they're going to have to pass that down to us. But our opinion is now is the wrong time to be cutting funding, particularly with respect to emergency management. Even if we don't see a reduction in our grants locally, any reduction on the national level reduces our nation's ability to be resilient. And there is a finite number of resources across the United States to respond to things. And if you've watched the news over the last several weeks, my colleagues from Iowa to Texas are putting their communities back together. And a lot of resources are being shipped to those communities. And if we happen to have an incident like that next week, will there be resources at the national level available for us to be able to tap into? And so we're encouraging people to consider that and hoping that, again, I think IEMA has shared that prior to last week, there was already over 10 $1 billion disasters that happened in the United States in 2024. So in less than 6 months, we've already seen that number. The number of natural disasters and man-made threats continues to go up. And so we're just encouraging our federal officials to consider that when it comes to ensuring that we budget appropriately so that we can continue to remain a resilient nation. So, any questions for me?
Any questions?
Mr. Chairman, I would like to add just to that last piece that Jason spoke to. As he said, we sent a letter under Chairman Dillon's and Jason's signature to the congressional delegation. Senator Duckworth's office and Congressman Sorensen's office have taken keen interest in the issue, and we're following up with them. This is an appropriations issue in the Department of Homeland Security. That's where the money gets appropriated each federal fiscal year, and they're going to be lobbying along with our federal lobbyist, who's also aware of the issue on our behalf, and which means the state of Illinois' behalf to get Illinois' allocation in that federal grant program reinstated.
Thank you. Any other questions? As always, you have a full plate. Thank you for everything you do. Next, the Regional Office of Education.
Hey, Beth, would you talk into the microphone a little bit better, please? Thanks.
We are very proud of our book distribution. We gave out hundreds and hundreds and hundreds of books at PNC Worldwide Day of Play. They were all career focused, including the baby board books. So that was awesome. And we have a follow-up event where we're partnering with Senator Kaler's office. Jennifer helped me get set up there at the Alpha Park Library, where there will be an additional distribution. We have pre-K classrooms over there, so we're trying to drive all of our families to summer reading. The summer slide is real. Children lose months and months and months of literacy gains that they made over the year if they don't keep reading all summer. So we're going to be doing that. And I just can't thank all of you. It takes us all to pull off the GMB, as we call it in the biz. The Gerald M. Brookhart Arts and Education Spring Celebration wrapped up its 38th year, if you can believe the kids have been coming down. And I would argue it was the best one yet. We had glorious weather, lots of food trucks and things for the kids to experience. The talent was showcased. So thank you so much to all of you, because you have to endure it. You have to endure the no parking, and you have to endure the kids everywhere and coming in and using the bathroom, and you're just welcoming, and I am so appreciative. And those of you that sponsored, thank you, Chairman Renault, and thank you, Camille, for your support, for sponsoring some of the stages, and everyone else that was a part of it. It was great. We will see you again next year. Kicking it off with Jazz Day at the Peoria Riverfront Museum. Also in your notes, I told you a little bit about graduations. We graduated 4 kiddos, and our principal was just featured on the Greg and Dan show this week. Again, recruiting kids to the school. I was on the Greg and Dan show this morning because tomorrow we're hosting a foster care event in conjunction with some local partners. We are in desperate need of families that have loving homes that want to foster, especially those teenage kids. There are a lot of kids that sleep in offices because there is literally nowhere for them to go, or they get stuck in hospitals or other facilities that we don't want them in. We need them in loving homes because there's a lot of not good outcomes for kids when they're not placed in good foster homes. So we're hosting a fair tomorrow. It will have all kinds of information and agencies and a panel featuring your own Jamie Harwood, sharing their experiences of fostering and adopting. Last but not least, I wanted to touch on the Truancy Advisory Board because they met again. It has had the single biggest impact that we have ever had in dealing with truancy. Our strategies up to this point have been we go to the homes, we call, what do you need? We provide lice kits, uniforms, you name it. What does the family need? We're knocking on the door. Do you need a ride to the medical appointment? But sometimes the problem is so systemic and so big and wicked and connected that the Truancy Advisory Board wraps all these agencies around these families that are experiencing truancy. And the kids we've put through, we had one that was not real successful, but all of the others were coming to school. I'm talking about kids who are missing 75 days of school this year. Finished the year strong, and I could not be happier. I cannot wait till next year to start it right from the beginning of the year and get some of these kids what they need. One mom needed a washer and dryer, and it changed the family's life. And I started thinking about that on a real deep level of what it would be like to not have that and have kids. I just don't even know. I couldn't handle it now with just me and my husband. So beyond that, we applied for a lot of grants, so fingers crossed. The budget that was passed yesterday looked good for us. We were written in there for a couple different things, and but we also applied for some additional grants, especially around truancy. So I will let you know when we know.
Fantastic. Thank you. Does anybody have any questions? Okay. I'm going to jump to the Center for Prevention of Abuse. I think Becca's going to try to make it if she can. If not, I'll fill in for her. Welcome back.
It's good to be back. Last time around, I wasn't able to come, and my colleague took care of the report. My name's John Worsham, and I'm the Regional Ombudsman at the Center for Prevention of Abuse. You should have a copy of our statistics in your packet. I wanted to take a couple of minutes and explain to you exactly what that term means, ombudsman. Until I came to work for the center, I had never heard of an ombudsman. An ombudsman simply means we're an advocate. We go into all licensed and certified nursing homes, assisted living, supportive living, SMRFs. A SMRF is a specialized mental health facility, and we also go into the developmentally disabled homes. And we make a presence in our area once every month. In the case of Peoria County facilities, because of the grant, the partnership that we have with Peoria County, we are able to get into every home multiple times each month, and it makes a tremendous difference to be able to help these folks who many times have no family. They have no one to help them, and we're able to make a real difference, and much of that difference in Peoria County is because of this partnership, and we at the center want to say thank you for that. We wish they would call us something else because folks can't remember what ombudsman means. I go in and they call me the O guy, and we're advocates. We don't go in helping to find out what's best for these residents. We go in to help them advocate for what they want. If that is maybe to make a choice, if that is to uh, have a difference in their lifestyle, we do our best. Uh, as you look over that list, I'm not going to read the whole thing to you. When I was in school, it made me very uncomfortable to have someone read to me what I could read myself. But those information to individuals are times that we talk to someone. We're not able to open a case, but we are able to give them information about what we do and how they can ultimately advocate for themselves. We'd like to work ourselves out of a job. We know that won't happen, but if an individual can gain the courage and the knowledge to advocate for themselves, that's what that information and assistance to individuals is. We were able to close 19 cases in Peoria County. Some cases are opened and closed fairly quickly. Some of them are open for a year or 2 years. Resident council meetings, we go to every resident council meeting within the Peoria County area, and we find out what these folks want and do our best to try to help them. We give out information to facility staff. How many of you have seen the bus driving around? It's beautiful. That bus, I get calls weekly because of that bus. And it seems as if we get more and more every month. I'm kind of surprised at how this has worked out. That bus brings in multiple calls. Now, we found out many of those calls are not for us. They see that ombudsman term and they don't know exactly what it is. Maybe they think we're helping people in a home setting. So we're able to give referrals to other city and county and sometimes statewide agencies. We are able to refer to the health department. We're able to report to and refer to Adult Protective Services, the Illinois Department of Public Health, sometimes the Peoria Sheriff's Department, the police department here in Peoria. And then the routine visits, that's the number of times our ombudsman go into facilities. I don't have an exact number, but about 32% of our facilities in our 6-county area are in Peoria County. So that's going to translate to 30-some facilities. In the other counties in our area, many of them only get one visit per month. You can see the difference that your funding has made, and that increased funding provides answers to problems. I do have a couple of success stories I want to tell you about. We had a Peoria County resident that wanted to go home. She had entered the nursing home for rehabilitation, and the family didn't want this resident to go home. There were some family dynamics that were going on, and our Peoria County dedicated ombudsman attended a care plan meeting and explained to the family and the staff that this person had the right to go home. It was safe for her to go home. And a plan was made to use the resident's health benefits, which she had because of her retirement at a local company, to be able to have round-the-clock home health care for a number of weeks after she got home. This resident was happy, and the family stated that they hadn't even thought to check into health care benefits. That was something that we were able to make a difference. Another resident had been in a skilled nursing center in Peoria for over 11 years. This particular person believed he was qualified to live in an assisted living center, but the facility actively prohibited his transfer to another facility. As a matter of fact, this resident had reached out to a assisted living, and the new center had sent a social worker to interview him, and that facility had, the original facility had actually threatened to call the police to have them escorted off of the premises. Our people got involved, and it was a wonderful success. After living in that facility for 11 plus years, he was able to transfer to a very beautiful assisted living. He's able to take care of himself, and he reported that his first activity was to go fishing with a number of his new friends a couple of days later. We also have talked a lot, and I hope you'll excuse me for taking a drink. I've got multiple sclerosis, and that's one of the things, unfortunately, I have to live with. This facility had a terrible infestation of bed bugs. Right now, we're seeing 2 facilities in Peoria County that have severe infestations. I'll say more about that in a minute. Residents in this facility were being threatened with discharge because they had bed bugs, and we submitted that those bed bugs are brought by other people into the facility, and they were threatening them with exorbitant fees to have their furniture cleaned and to have their possessions taken out. And we were able to successfully advocate that these residents needed help, and we were able to get them help moving furniture, cleaning their clothing, and they successfully received the help that they needed, and the rooms were successfully treated for bed bugs. This is at a Peoria County supportive living facility, and I'm happy to report for the first time in almost 4 years that facility is free of bed bugs. We had problems for several months. The problem had actually cleared up, but is coming back. We've seen at least 2 residents that I'm aware of that were admitted to the hospital with systemic infections because of bed bugs. Now, I can't tell you that the bed bugs caused the infection. Both of these residents were severely diabetic, and because of the bites that were all over their bodies, they ended up in the hospital and required some pretty drastic intervention. And last, we continue to see a lot of issues with involuntary discharges, where the facilities are trying to send these residents home, and if they can't send them home, they'll try to send them to another hospital or even to the rescue mission. And they've started figuring out, well, if we send them to Galesburg to the mission, John and his staff won't know about it, but we do find out about it. And these are just some of the things that we're able to do because of our partnership with Peoria County. And we want to say thank you for the difference that you all have made and allow us to have part in.
Thank you. That's a good, nice report. Does anybody have any questions? Well, we appreciate the work that you continue to do. Next is sustainability and recycling, and Becca is not able to make it today. Her report is part of the packet. A couple of the things that I talked to her yesterday, she wanted me to highlight. One is they had a very successful recycling of electronics in West Peoria. Recently, they collected almost 12,000 pounds of electronics for recycling. And the second thing is the hazardous waste collection. They don't have a date yet. They're hopefully we'll have something this fall, but it's been postponed right now. So that's all I got. Does anybody have any public comment? Anything from miscellaneous?
Mr. Chairman, I have one thing if the committee members don't have anything first.
Sure.
Just for the committee members' benefits, so starting either next month or the following month, care and treatment will start to come through administration. We're transitioning from the health department providing the administrative support staff to that board to county administration. So,
okay. All right, we're adjourned. Thank you.